In this video, we are going to talk about how to check baby neck motion and for the signs of torticollis in your baby so that you have all you need to screen, and then you can take action if you notice there are differences side to side or any of the risk factors we're going to talk about today in this video. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel we help proactive parents learn how to help their babies move better. Think of me as your pediatric physical therapy bestie, here to help you learn tips and tricks to help your babies move with confidence and ease. Today we are talking about all things neck mobility. There are actually 6 directions that every single parent should check on their baby just to make sure that the baby has equal motion in their head and neck area side to side, and that there aren't any risk factors for torticollis. Babies can have their neck motion screened from the time that they are newborns all the way through 9, 10, 12 months. Now, you might notice older babies are a little bit squirmier. The most optimal time to screen your baby is actually within the first month of life, because if you do notice signs and symptoms of torticollis, your baby with proactive pediatric physical therapy will have a much lower treatment time if they receive pediatric physical therapy by the time they're a month and a half. Now, if a baby is over a month and a half, pediatric physical therapy is still your go-to. Now, today we are going to talk about 6 directions: ear to shoulder range of motion. This is called lateral flexion or side bending of the neck. We're going to have rotation where your chin goes over your shoulder, and we're going to have extension of the neck as well as tucking of the neck. All of them are really important. Now, you may be asking yourself, is it normal that my baby only looks to one side? And the truth is that all babies may have some slight preference, but what we want to make sure is that a baby is given the opportunity to move their head in all directions equally, or that we are spending some strategic time in the directions that maybe are less natural for them. And we also want to make sure that there isn't any muscle tightness that is preventing them from moving their head. Babies have more mobility actually than we do as adults. So when we're looking at these different directions, ear to shoulder, for me as an adult, I have about 45 to 50 degrees either side. And for babies, you're actually going to have anywhere from 60 to around 75 degrees of neck motion. Ear to shoulder, their ears can basically get to their shoulders, and what you want to do is make sure that that motion is equal. In this video, I'm not really going to show you any tools, but I can pop up some of the tools that we as pediatric physical therapists use up here, and as well as link them in the descriptions below. This video is really basically just to help parents do quick screens so that if they notice that something is different side to side, that they can then take the next action, which would be to notify their pediatrician as well as proactively get into a pediatric physical therapist ASAP. And if you're looking for a full comprehensive resource that talks about both the screening of the neck muscles, the strength of the neck muscles, signs and symptoms for torticollis, rolling, and tummy time, make sure you check out my newest book, Tummy Time and Learning to Roll, a baby development book for ambitious parents and pediatric healthcare providers to help babies learn to roll independently, because it is going to have an entire section on risk factors. So it's going to go through head shape / plagiocephaly, torticollis, tone, hip dysplasia, and constipation. It's going to have pictures, a example of how PT can help with plagiocephaly, kind of how we would measure plagiocephaly, what torticollis looks like. So this is going to be linked up here, but also in the description and in the comment section. What are the signs and symptoms of torticollis? So if they have a tilt to the right and a rotation to the left, so they prefer to keep their head rotated to the left, and you see a right tilt, that's gonna be a right-sided torticollis sign. If you see a baby's head tilted to the left and a preference to keep their head rotated to the right, that's gonna be a left torticollis sign. Right rotation preferences and right-sided flat spots are the most common. I would say about 70% of plagiocephaly is right-sided flatness, right-sided rotation with a left-sided tilt. Now, if a baby's tilt is changing sides, that is something you want to bring up with your pediatrician because there's multiple different types of torticollis, so you want to make sure that you have your pediatrician on board. Let's get into determining how you screen for neck tightness in all 6 of those directions. Hey, yeah, what is that? So when your baby is laying on their back, there are 2 types of directions you want to look at. You want to look at the ear going towards the shoulder on both sides, and then the chin going over the shoulder. So what I'm going to do is have a very gentle open hand position, and we're going to do rotation first because usually that's the easiest one. So I'm going to bring my hands behind their head. Hi, and I'm just going to gently bring myself over to the side and bring their ear onto the floor. Hi, you're doing so good. Hi, sweet man. Hi, good job. And then while they're here, I want to make sure this shoulder is down. Now, if he goes to rotate his head, then I'm going to allow him to. I'm never going to hold a baby against the resistance. And then we're going to go to the other side. Hi, good job. Hi, good job. Hi, good job. Nice work. Hi, that was good. So he was equal on both sides there. He doesn't love to stay at end range rotation, but he is not fighting that at all. The other thing you want to do is do passive range, but you also want to see if actively they can track in both directions. And then bring that head all the way to the other side. Good job. The next one is I'm going to have a gentle hands high, and one hand is going to be behind his head and the other is going to be here. Hi. Oh yeah, good job. So you can do 2 hands if one hand is not enough. Hi. But ideally, I would want to stabilize this. Good job. Hi. And again, as he wiggles, I'm going to allow him to wiggle. Hi. I know that one is not baby's favorite. It's not. No. Oh, bless you. Bless you. Where's your rag? Let's get that off your face. Hi. Good job. So what you can do is, hi. Can we try a passy? So you can see here, I'm just bringing his head to his ear to his shoulder. And then I'm gonna come over and just bring his ear to his shoulder and just make sure that they're the same direction side to side. Yeah, and then the last 2 directions you wanna look at is his ability to bring his neck to his chest. When I bring both my hands are gonna be behind his shoulders. Hi. And I'm gonna be down closer towards his pelvis. And I'm going to lift his shoulders up and see if, no, thank you. Hi. Yeah, good job. So I'm gonna see if he will tuck his chin to his head, to his chest. And as babies get older, shoulder, so in the 3 to 5 month range, I want to make sure that they are tucking their chin when they're coming up. You can also put a toy in their lap and come down here and see if they gaze. Yeah. Good job. And I'm supporting my fingers behind his head. Last direction is backwards. So you're gonna put the baby over your lap and your hand is gonna be behind their head. And you're gonna dip their head back just to see if there is redness back here and if they tolerate it. He struggles with this guy. He does not like it. You see how red our little friend's face got? Yeah. So that means that there's likely some tightness in the front of their neck. I know. We weren't a fan of that one. I know. You might be asking yourself, how do I know if my baby's neck is moving far enough? The biggest thing that you are gonna wanna look for is, can they get their ear to their shoulder without also lifting this other ear? That's gonna be approximately, I can't because I'm an adult, but babies are gonna get their ear even closer. That's gonna be approximately 60 degrees, 60 to 70 degrees of side bending or lateral flexion of the neck. You wanna make sure it's side to side and that the opposite neck doesn't have any redness, any creases. It doesn't get red when you pull on it. You're only gonna go to the level of the baby's resistance. You're not gonna yank on their neck, God forbid. You're gonna go nice and slowly and you're gonna stop when they tell you to stop. It should go nice and fluidly from one side to the other. There shouldn't be any resistance there, and if you feel resistance, that is tightness. The next direction you're gonna look at is, can they get their ear onto their floor and their chin over their shoulder, both on their back as well as on their belly. That's gonna be around 90 to 110 degrees of rotation. If they can only get their chin to about their nipple line, that's about 45 degrees. If they can get it between their nipple line and their shoulder, that's about 75 degrees. And what we really want is ear on the floor as well as chin close to the shoulder or past the shoulder on their belly. The next direction is neck extension. We really want to be able to relax this neck fully without being angry or crying or trying to move out of that position while you are supporting their head. And then the next direction is, we want to be able to bring them up from the ground while tucking their chin and doing about 5 repetitions without relaxing that head back into a head lag. So those are the values that you want to look for. To sum that up, that is 60 to 70 degrees of ear to shoulder or ear very close to shoulder, equal side to side. Chin over shoulder, both on the back and on the belly, equal side to side. Neck fully relaxed and head back while being supported by the parent, as well as neck tucked while coming into a sit position multiple times, 3 to 5 at the very minimum. And that's a wrap, friends. Thank you so much for joining me today to learn how to check your baby neck motion, as well as to learn some signs of torticollis in your baby so that you can be as proactive as possible. If you are looking for a full comprehensive resource for infants, tummy time through rolling, make sure you pick up a copy of my newest book, Tummy Time and Learning to Roll, which is linked in the description as well as in the pinned comment. And I'm so proud of this book. It comes with 240 photographs of different play positions, as well as just a really great resource for parents if their little is struggling with rolling, or to help parents just have a really good thorough base of movement and play positions so that their babies can go from little cute newborns to moving, crawling, cute little humans in the most optimal way possible. If you have more questions, make sure you drop them in the comments below. I love answering questions from YouTube subscribers, and if you are a new subscriber, make sure you say hi. For those of you who want a little bit more one-on-one interaction, make sure you check the pinned comment for a link to schedule a one-on-one online parent consultation with me, where we can talk about all things tummy time, rolling, neck mobility, signs of torticollis, next steps that you could take with your little if you are concerned. If you are ready for another video, make sure you check this one out. It's gonna go through how to screen neck strength side to side. It's also gonna give even more detail on torticollis, plagiocephaly, and what to look for.